Good morning. Welcome back to 1160 AM KBBT News Talk Sports. We're JP, Kathy, and the crew, and we are excited to bring you the mental health moment. That's right. It is Tuesday. It is currently 8:35 here in the Metroplex. It is going to be a high of 43 today. Balmy, wet, tropical 43 degrees.
Okay, shut it down.
Go get a palm tree. So right now, currently it's 23 degrees outside and cold. So do be careful of any moisture that may be on bridges or on areas that could freeze over. Do be careful there as well. But excited about bringing you the mental health moment, brought to you by the Something for Kelly Foundation, the Morgan Foundation, and Acadia Healthcare. I want to thank them for being our sponsor. Super excited today because we have a dear friend of mine in studio to talk about her foundation and talk about all of the things that surround statistically, mental health-wise, adolescent suicide. And so, Vanita, first of all, welcome, Vanita, to the show. How are you?
Thank you. I'm so glad to be here. I'm fine.
All right. And Steve and Patty, good morning.
Good morning, John.
Good morning, John.
All right. Vanita, I'm going to start us off. Tell us a little bit about yourself. Tell us a little bit about the foundation, why it was established, and what it does.
Well, I was the mother of a struggling teen. My son, Grant, had chronic depression, diagnosed at age 14, and then developed bipolar disorder 1 with psychoses at age 19. We got him help throughout those 5 years for his problems, but he, including a 30-day stay in a psychiatric hospital. But 2 weeks out of the hospital, he jumped to his death from a 10-story building a block from home. So, I was left reeling with the question, what happened here? Because our family would have done anything to get him whole and well. And we just didn't know everything we needed to know at the time we needed to know it. And so right there is where the foundation began. I thought, if we couldn't figure this out, there must be other families, other adults, teachers, school staff, people who don't understand everything that we need to know about mental health and suicide prevention. So that was 13 years ago, and here we are today. We're doing a lot of work in the schools and in the community, doing trainings on those issues. This year alone, we've trained 40,000 students, parents, teachers, and mental health professionals. We also are very big on encouraging people who are in the fight for a young person's health. So we have a peer support group for moms, free support group that meets 3 times a month, and a breakfast speaker series for dads, for men, with a special speaker every quarter. Those are a couple of things that we do.
And that's amazing.
Well,
God bless you for what y'all do and for the people you help. Yes, absolutely. Absolutely, JP.
Yeah. Steve, what else do we have for Vanita?
Vanita, yes. Hi, this is Steve Dunn again. I've had the pleasure of meeting you a few times and attending a few of the meetings you held, and just wonder if we could start off by you telling our people out there what it is your foundation does. How does it raise the awareness? How did you reach out to those 40,000 this past year alone?
Sure. Well, first of all, we think that everyone needs to know more about what the symptoms look like when a person is struggling emotionally or mentally, and what the warning signs look like when a person is actually thinking about taking their own life. So the core of our presentations focus on that, even for students and young people, young adults, parents, school staff. We do trainings of trained HR managers at large corporations. Everyone needs to know this information. We also have a presentation on bullying prevention, and you know what? It's not about upstanders and bystanders anymore. That's not what it's about, and that didn't work to talk to kids about that. It's a culture of cruelty now, and so we are now teaching kids that what they think is acceptable, normal behavior, the way they talk to each other and treat each other, because they do, it's a culture, is not, and that we're going to teach them up to be a kinder, gentler, more respectful generation of other humans on the planet. And then finally, the other presentation we do is on resiliency. And this is important for this reason. When I got into this space 13 years ago, the Centers for Disease Control was saying that 9 out of 10 suicides were the result of a mental illness that went back at least a year. That's a huge 90% of suicides.
That's staggering.
Yes. Well, 2 summers ago, they came out with entirely new studies and information, and now they say more than half the time when a person takes his own life, it is simply because they didn't have the problem-solving or coping skills to get through a hard time in life. That really resonates with me because I see our children being raised in helicopter or more currently bulldozer parenting. They're not being allowed to fail, so they're not learning resiliency.
Right.
So we're teaching resiliency. Our presentation is called Bounce Back. And I just want to note that we never charge nonprofits for these presentations or Title I schools, colleges, churches, anything like that.
Very good. Vanita, you talked a little bit about some warning signs. Could you go into what parents or counselors or teachers or friends can look for? What are some of those signs?
Well, first of all, when we talk about suicide, we want to back up to talk about what leads up to it. Like if we were talking about heart attacks this morning, we would talk about heart health, not just how to perform CPR, but let's go back to diet and exercise and the things that keep your heart healthy. So we like to teach people, first of all, what keeps your brain healthy. Because the brain's an organ of the body, just like the stomach, heart, and lungs, and we shouldn't treat it any differently in terms of if it needs help, we need to get help for it. So stress is number one, because when we let our stress levels get too high, unrelenting stress, it can make the brain sick, and that sickness is called depression. So stress is the number one trigger for depression. Depression, untreated or undertreated, puts a person at higher risk for thinking about suicide. So we want people to know that for stress, it's okay to push the pause button, do some positive stress relief things so that you can stop take care of your brain health at that level. Depression, any kind of change in mood or personality, irritability, sleeping too much, sleeping too little, eating more than usual, eating less than usual, the symptoms of depression, and all this is on our website. I know this is a lot of information. But the warning signs of suicide, in the 5 years that we fought for our son's mental health, no one ever told us what the warning signs of the fatal outcome of this disease could be. No one said there was even such a thing as warning signs of suicide. No mental health provider, not the hospital, nobody.
And you would think that the people who that's their job and their profession, that this would be something that's, information that's easy to access. Now, thankfully, it is through y'all's website, which what is your website?
It's granthalliburton.org.
Okay, and we are putting that on our Facebook Live feed, and we encourage you to please share this post today. Tell people to go to the 8:34 mark. This is so important. This show right now could be saving someone's life. And I'm also glad that you're bringing this about, just like Patty and Steve, and like we're doing here on our show, JP, Kathy, and the crew. It's okay to talk about this stuff.
Right. It needs to be okay to say that you're not okay.
Amen.
That is the beginning
Amen.
of erasing the stigma. But I didn't tell you the most important part of this, the warning signs that a person's thinking about suicide.
Yeah.
They're not intuitive, but if you know what they are, there are 12 warning signs, and I'll just mention a couple of them. Number one is a change in mood or behavior, like a drastic change. All these are drastic changes.
What would be an example of that?
Well, an example, if a person is normally even-keeled and is kind of quiet, and they become outrageous and loud and boisterous, risky behaviors without any regard for their own life or anyone else's. Isolation and withdrawal, and I don't mean just going to their room. I mean it's like zombie-like withdrawal. Certainly dropping out of things that they used to enjoy, giving things away. This is a young person's a way of putting their affairs in order. And the three big ones are talking or writing about wanting to die, making a plan, like Googling ways to take your own life, and giving up hope. When a person gives up hope of feeling better, being free of the pain in their life, that's a very dangerous time, and you're dealing with a crisis.
Those are all really very important. Thank you. And again, give us the organization name.
Grant Halliburton Foundation, and it's granthalliburton.org.
So speaking of resources, we also know that you have Here for Texas.
Mm-hmm.
Tell us about that. What is it?
Sure.
What does it do?
Yeah. So when I was when I got a call from the middle school counselor in 8th grade telling me that my son was self-harming, I was blown away. I was devastated, because to look at that child, you would never believe he had a care in the world. I had no idea how to look for professional help. I had no idea where to start or who to ask. You can't always ask a coworker or your boss or the PTA president or even your family members sometimes when you're looking for a therapist.
Right.
You just don't know where to start.
And you don't know where to start. And also, there's been such a stigma attached with, I can't talk to people about that.
Right.
And
There
thank
still
goodness
is.
y'all are,
Mhm.
but your organization's changing
We're
that.
trying to change that.
And that's what we desperately need in this society.
Right. So we started this website called herefortexas.com, spelled out HEREFOR Texas.com. And it is a searchable database of over 800 mental health providers in North Texas. And you can go in there and you can enter all these filters about your location, about the age of the person you're trying to help, the specialization, the language you need spoken, payment options, insurance, no insurance. And out of that 800, it'll pull up a short list of the ones that meet your criteria. And then you can click on any one of those and it pulls up a long, exhaustive page of information about that provider. So we think this is all geared at helping people connect with resources, making it easy for people who need help to get connected with people who can provide that help.
And is this for all
Now,
mental
Vanita,
health illnesses?
you also have a mental health navigation line.
Yes.
How does that work?
Yes, we do. And both herefortexas.com and the mental health navigation line are for all ages. We focus on youth a lot in our educational efforts, but this serves all ages, and anyone can call and call for anyone else. So the navigation line, sometimes you just need to talk to somebody. Websites can be daunting, and you just need to say, this is my problem. I don't know what to do. I don't know where to start. And so we have trained navigators that take all the information. We have 3 mental health professionals on staff who case manage every call, and then we get back to the caller with an email spelling out 3 to 5 resources that we think would be helpful to them. And then in a couple of weeks, we call them back and say, was that helpful? Were you able to get an appointment? Is there anything we can do to help you? So we feel like that's going to be a real help to people when they're looking for mental health resources.
Talk a little bit more about resiliency, because I know that that's a theme that several of our guests have spoken about. And the helicopter and bulldozer parents and all of that. Talk a little bit about what your program or your presentation looks like when you're sharing information about resiliency.
Right. Well, we base our presentation on Dr. Kenneth Ginsburg's 7 C's of Resiliency. He's kind of the acknowledged expert in this area. And so we talk to parents and children about that too, because while we're telling parents and adults and teachers and all the adults in the lives of our children to let children fail and help them navigate failure and disappointment and heartache and hard times in life. And when we talk to children, we said, don't let the adults in your lives rob you of the opportunity to learn how to get through hard times. You're going to need this. So we teach all that. And one thing we also teach is that there's a difference between being a helicopter parent and a lighthouse parent. That a helicopter parent is hovering over a child all the time, and the child doesn't know how to do anything. They just stay in the light of the helicopter that's shining down on them. But a lighthouse parent stays on the shore and shines a beacon of light so the child can see how to navigate, for example, through a rough, stormy sea and get to the shore. And when they get there, they know how they got there. They had learned how to navigate the rocks and the wind and the waves. And there's just a simple difference, a big difference in that, in shifting from being we tend to equate doing everything for our children to good parenting, and it's
Right.
just not that way.
Right.
So for parents that are already helicopter parents and you're trying to coach them into being a lighthouse parent, what are the things that you help them do so that they can pull back and become that beacon?
Well, we go through those 7 C's, and I won't name them all here, but competence is number 1. And if you don't help a child develop competence in it can be anything, learning to build a sandcastle, learning to ride a bike. If you never let them wiggle and fall while they're riding that bike, they're not going to develop competence in riding the bike, and they need competence for all the other 6 C's, like confidence and character and things like that. So we talk about simple illustrations like that, and then say, it's never too late to start. Maybe you have a 10th grader, 11th grader. It's never too late to start developing resiliency.
Great, thank you.
All right, we're here at the Mental Health Moment. We have Vanita Halliburton joining us with the Grant Halliburton Foundation. Also, we've got Something Kelly Foundation and the Morgan Foundation joining in with us, and Acadia here at JP, Kathy, and the crew to bring you the Mental Health Moment. And we bring this to you so that you can sit at home, hear the information, sit in your car, gather the intelligence, or at work, and understand that, you know what, there is help out there for you, and you can reach out without judgment and get that help that you need. Remember, your family loves you. We love you. We want you to stick around and be a very active member of society. So we hope that this is able to help you out. Stay tuned. Also, you can catch us on Facebook at JD and the crew. We continue the conversation through Facebook while we are on our break. So stay tuned. We'll be right back. Okay, Steve and Patty, take it away over Facebook.
And we can we're still on Facebook Live, so keep on talking. And I've posted the this event and then a link to your website on our Facebook radio show page.
Right.
So in case anybody needs help. So
Vanita, I'm curious. So let's say if you're a young person in the 8th or 9th grade, and you see someone you're a classmate, a dear friend that you're really concerned about, what is the best way to address that? Do you go to their parents or a counselor or who?
For a student
Yes.
who sees another student?
Yes.
Well, this is interesting that you ask that, because we teach everyone, children included, how to have a conversation with people they're concerned about, how to ask the right questions. And if you determine that they are feeling suicidal, then our job is for young people is to connect that other student with the school counselor. We don't usually recommend going to parents. Let that go through the school counselor, or if that's not an option, then they should tell their parents and let an adult deal with with that news for the parents. But for everybody, we say, here's our little acronym is TAG, which stands for Take It Seriously, Ask Questions, and Get Help. And that is what we teach children and adults alike. Learn how to have that conversation and learn how to connect a person with help. If it's you, if it's a friend, if it's not at school, then your number one thing is take that person to the emergency room. That's your job, to keep them safe and get them where they can be treated.
So in terms of getting the word out, in inspiring and trying to inform, what have the biggest obstacles or challenges been that you have faced?
Well, I think that number one, it's a big city, and that's a challenge. And number two, the good news is it's a big city. Sometimes people say, why aren't you going national with this? Why aren't you traveling and doing this? And I'm saying, because we have a big backyard and we need to take care of our own people first here. That 40,000 sounds like a lot, but there are so many more young people in the city, in the schools for us to reach. So I would say reaching everyone. We've grown a lot over the last years. This program has grown a lot, education program. But I always say we can't work hard enough and fast enough to get where we need to get in defeating stigma and getting people to understand it's okay to ask for help.
And we all know that one person is too much, but what are the statistics now? Is suicide amongst adolescents on the rise or decline? What is your understanding of that?
Yeah, sadly, it's on the rise. But suicide for ages 10, which is a terrible age to be mentioning in suicide statistics, ages 10 to 24, it's the second leading cause of death. And in the last 10 years,
that's not right.
I know.
You're 10, you're a baby.
I know, and we don't talk. People don't know that. You don't talk about that. In the last 10 years, for ages 10 to 14, the suicide rate has tripled between 2007 and 2017.
This should be like national headline news all day, every day. Get the impeachment junk off the air. You know what? Why aren't we talking about all of these precious lives that we're losing?
If it were a mosquito-borne virus I was here to talk to you about today, it would be on the news every day.
This would go viral.
And it has been in the past, even though the number of deaths from that are minuscule compared to suicides.
Unreal. Now, I know when we do come back on, we want to try to really
10 seconds.
emphasize.
We've got about 10 seconds.
So
Good morning. Welcome back to 1160 AM KBDT News Talk Sports. We're JP, Kathy, and crew. We come to you live Monday through Friday from 7 a.m. to 9 a.m. Today is Tuesday. We have the Mental Health Moment, and we have joining us Vanita Halliburton with the Grant Halliburton Foundation. And we are so pleased to have her with us here in studio. We also have the Morgan Foundation and the Something for Kelly Foundation, along with Acadia, bringing this news to you every Tuesday morning at 8:34. It is currently 8:55 here in the Dallas-Fort Worth area. Your high today is 43 degrees. Your low 26 tonight. Currently 26 degrees in the Metroplex. All right, Stephen, Patty, and Kathy, let's kick it back over to Vanita and let's continue the conversation. And again, you can pick this up on our social media at JP, Kathy, and the crew as well, because it's archived there and you can pick up that information if you can't stay on now.
Vanita, yes, and again, thank you so much for coming out today and just enlightening us and giving us so much information. But if you had to give 3 pieces of advice, your 3 most important pieces of advice to the moms and dads and counselors and teachers out there, what would that advice be?
I would say number 1, get educated about mental health. Find out as much about that as you know about strep throat and you know about measles and other illnesses, because mental illness is a disease of the brain, which is an organ of the body, and we need to not pretend like it's some mysterious thing that we can't understand, and so therefore we don't pay attention to it. I think finding encouragement, get connected with other parents who are dealing with children or grandchildren with mental health and addiction issues. We have 2 support groups for that, a support group for women and a breakfast speaker series for men. Stay connected. You know, we're not meant to be in isolation, and support for one another is very helpful. And then finally, reach out to us on the navigation line at 972-52581. It's a free resource. It's personalized help, helping you find what you need. And then our website, herefortexas.com, has not only a searchable database of 800 mental health providers, but also tons of information and education about mental health issues on it.
So how exactly does that call-in line work? Let's say if a person wants to stay anonymous at the start, just tell us a bit about how your helpline operates.
Well, yes, it is. You can be anonymous. We need to get back to you with resources, so we'll need an email address or some way to get back in touch. I'd like to tell you a quick story of a call I took recently. This kind of shows the scope of what we can do. So I got a call on the navigation line, and it was the mom of a 12-year-old boy who had 4 mental health diagnoses. He had a lot of problems. He was 12 years old, but he was in 3rd grade because he'd been held back a couple of times because of his problems. And so she wanted to find some help for him. And as we talked, I learned some of the other things I need to know, like do you have insurance, a job, ability to pay, where do you live, etc. Turned out she had no job, no insurance, no money. She was living in a homeless shelter in downtown Dallas and no transportation. And I thought, okay, this is going to be interesting. I said, so you need a place you could walk to? And she said, no, I can go anywhere Dart goes. So we found her 2 private practice therapists who were willing to give free therapy for that boy. One of them was a mobile counseling service, so they would go to her. The other was on the Dart line. And then the third thing we gave him was a wraparound youth advocacy service to see that their other needs were being met. So this is how we do this. It absolutely is customized to each person's situation.
That's an amazing success story, and I think that those resources
really
are tremendous.
is.
Absolutely. So is that staffed 24/7?
It is not 24/7. We are careful to distinguish that it's not a crisis line, although we've taken crisis calls, but it's a navigation helpline, so it's 10 to 6, Monday through Friday.
And how many people do you have working in that arena?
We have about 30 trained navigators right now, and that doesn't take 30 people in a big room like you would think a call center would.
Yeah.
We have a couple of 2 or 3 people who are available at any time.
We love to end this with the hope and the solutions. And you mentioned hope earlier in the session here. So talk a minute about the hope that is available to people through your resources and through the community. And do you have any other success stories that just would be inspiring?
Well, we just like to impress upon people that like any other medical condition, there is treatment. Stress is manageable, depression is treatable, and suicide is preventable. And our theme line is Grant Halliburton Foundation. It's about help, it's about hope, it's about peace of mind. And that's everything we do is kind of geared toward that.
Well, clearly, 40,000 people touched in this year, and they would contact you through the Grant Halliburton
Sure,
organization
absolutely.
to get you to come out and do a presentation for them as well.
Our contact information is on our website, which is granthalliburton.org. And there is a section called Education where you can get more information about what those look like and how to schedule.
Perfect.
Vanita, again, thank you so much. This time, as always, has just flown by, but hopefully we have saved a few lives today.
I hope so.
Absolutely. God
Thank
bless you.
you.
And keep up the good
Vanita,
work.
thank you
you.
so
Well,
much.
JP, Kathy, and the crew will be back tomorrow. There we go. We're still on Facebook if you want to talk more about it. I want to know why Facebook just, they deleted my post on our
really?
live feed now, because I put it in both of our things. I'm going to see if they're going to kick it back again. Yep, they sure did.
Huh, that's interesting.
It's interesting. They're saying
Was
Who
it
is
something
they?
we said?
faith,
The evil Facebook.
evil Facebook people. It said, your comment goes against our community standards. Only you can see it.
Which
But that's
comment?
weird because I put it in on my personal page and on our JP, Kathy, and the crew, like in the description, like, hey, suicide prevention, watch today's show, and let me put it. But on the other, it didn't. So, anyways, well, I'm gonna keep trying to post it.
Interesting.
So, there you go.
We will look into that.
Okay. JP, did you want to say anything else or getting more messages out there to those on Facebook?
No, I'm good. I think that they did a good job. I think Vanita did a great job as
You
usual.
were phenomenal.
Well, I really
Wow.
appreciate being invited. Thank you.
Oh my
And thank you
goodness.
for coming. I know
Yeah,
this-
definitely. Well, and again, we encourage those of you who are still with us on Facebook, who are watching this, the after show that we have with our
show.
mental health moment on every Tuesday.
Prologue.
This is one of those that tell people to go in. They don't have to watch the whole show today. Tell them to go to the 8:30 mark and tune in. You know, you never know who is hurting, who needs help, who doesn't feel comfortable maybe going to friends or family. And a lot of times that happens. So, just reach out because there's help available. I mean, y'all are doing God's work, and thank you so much.
And let's see, we should have this segment up in the next few days. Of course, it'll be posted on
Perfect.
your side and on the
So
something
share it,
Kelly LinkedIn,
please.
Morgan
Yes.
Foundation LinkedIn.
Correct.
Next week, I believe we're having a doctor from Timberline Knolls, their medical director, talking about insurance companies and insurance issues. Aren't those
Oh,
always
very
fun?
good.
Wait, what is this you speak of? There's no,
There
issue,
you
there are no
go.
issues there.
Can you
And
say
at
that on
the
the
end
air?
of this month,
I think you
in
just did.
2 weeks, which is Thanksgiving week, Ms. Patricia, we are having
Dr. Michael Luder, and he's going to talk about eating disorders and the stress and the struggles, whether you are concerned about overeating or you're afraid of being overwhelmed by
Like
too many
during the
choices.
holiday kind
Yes.
of a thing. Oh, yes. That's
Good.
perfect.
Very
we met with him this past week, and I like to think I'm reasonably intelligent, but I had to go home and find eating disorders and genetics for dummies
just to
book.
figure
This
out.
man is brilliant,
Wow.
and I asked him, Doc, your IQ was like 500,000, and mine's like
rest of us
down
are
here.
here.
Or will you be able to take these Harvard words and put them in Texas A&M language?
Mhm.
And well,
He will.
absolutely he will. I'll leave
When he
our
tunes into
Aggie
the rest
friends
of our
alone.
show, he'll be like, "Oh yeah, I do need to put this on."
So I
latest
think he'll do a good job. And in
Excellent.
December, then of course we have another guest, a local doctor who treats eating disorders, and we're also trying to line up a show on spirituality and mental health. Both here it is, it's December,
Oh, yeah.
and Hanukkah and Christmas and
that's
so many
fantastic.
other holidays. And I firmly believe that spirituality is an important part of the recovery process, and it doesn't get
Absolutely.
talked about enough. So
well, unfortunately, none of this gets talked about enough. That's hence the reason we're doing this segment on the show, and we just thank you so much. anything we can do to help, anything you want us to promote through our page, just tell us.
Thank you.
And we're good to go on that. So,
And and I wish we had time to go into what you did on the North Texas Giving Thursday. Brilliant idea. Congratulations on having the best day, one day event on Giving Thursday.
what did y'all do?
Well, actually, we got an award for the most creative campaign. We did a video in-house, did it all ourselves, and with the help of Dallas Puppet Theater. It's called a 5-part series called "There's No Place Like Hope," and it was based on the Wizard of Oz.
Oh, that's great.
And Dorothy.
Is it on y'all's site?
I'm sure it is.
I gotta go see that.
Dorothy, of course, was a struggling teen, and she was trying to find her way to the Emerald City, whatever, to a place of hope and help. Piece of mind.
Oh, how great is that?
Yeah, it was fun.
That's
It was
awesome.
cute.
Yeah.
It was funny.
That's
We had
awesome.
fun with it.
You have some creative minds
We do.
I
in your
love
team.
it.
That's important.
And then on the Giving Thursday itself, you had a restaurant. You invited your supporters to come out and
drop
grab.
by,
Love
have
it.
some appetizers at Medici's, and it was wonderful. And then we had some laptops there and some signage about how they could donate to North Texas Giving Day. So that's fun.
Love it.
Something to do.
I know that on that day, the Morgan Foundation teamed up with the Something for Kelly Foundation. JP, in one of the many brainstorms he had, said, let's bring people into Patty's office. It's this beautiful office overlooking the pond at Montfort and Beltline. And we had some food and wine. We plied people with some wine. Then it was like, why don't you get on your phones and start to call all of your friends
Text
and
people,
have them
let 'em
contribute
know.
$5 or
Exactly.
$10, however much. And we had a number of people there, I don't know, 50 or so at least, who were all on their phones,
It's
making
huge.
calls and
Yeah.
texting. And that was we
That's
hope
good
to build
stuff.
on that a lot next year and maybe steal some of your ideas.
Well,
too.
it's very powerful when you call somebody and say, "Will you give?" Or they're going to say, "Oh no," they're going to say no.
Yeah, they're going to do
Well,
something.
Even when you
They're
say
gonna do something.
$5, I
Sure.
mean, because you call 5-10 people that well, that adds up. That adds up. Well, okay, everybody, thank you so much again. How do people get in touch with you?
GrantHalliburton.org. That's just all you have to remember.
Excellent.
Thank you.
We will see y'all tomorrow. Mwah. Love y'all. Have a great day.
Okay.
Have a blessed day.
Have a good one. Stay warm.
Yes, stay warm.